Epilepsy is a neurological disorder caused by clusters of nerve cells in the brain sending out wrong signals. These malfunctions cause a condition known as seizures. It is said that 1 in 26 people will develop epilepsy in their lifetime. Epilepsy is the fourth most common neurological disorder. Epilepsy affects 65 million people worldwide, and according to the CDC, it affects 2.9 million people in the US alone, and it is said that 200,000 people develop epilepsy every year in the US. Causes of the condition are brain infections such as AIDS, meningitis, and viral encephalitis, head trauma from falls, sports accidents, or injuries, by stroke, brain tumors, or neurological disorders or developmental disorders like autism. And most commonly, in some cases, the cause is unknown. Signs in epilepsy can differ depending on what kind of seizure you're having. The two most common types are partial seizures and generalized seizures. In partial seizures, there can be jerky movements, tingling or dizziness, repetitive motions, staring and confusion, and even emotional changes. In generalized seizures, there can be convulsions, there can be twitching motions, falling down, or even loss of consciousness. Also, there can be biting of the tongue, loss of bladder control, and even stiffness in the body. As for treatment, there is no absolute cure for epilepsy, but there are medications that can help. Most commonly used medications are called AEDs, which are anti-epileptic drugs. Another treatment is epilepsy surgery, in which the doctors use imaging to find the part of the brain that is damaged and cut that portion out. With this treatment, in some cases, some patients were completely free of seizures or their seizures were better controlled. There's also a treatment called vagus nerve stimulation, in which a small incision for a device is placed under the skin on the chest wall that has a wire going up the vagus nerve in the neck and sends mild impulses of electrical activity to the brain via vagus nerve. There's also the ketogenic diet, which is most commonly used for children. This diet is high in fat and has adequate protein. It's a low carbohydrate diet. This diet forces the body to burn fats rather than the carbohydrates. There's also something called a deep brain stimulation, which is similar to the vagus nerve stimulation. With deep brain stimulation, it involves implanting electrodes within certain areas of the brain. 70 to 80% of people that take AEDs can live normal lives. Some people are even able to eventually stop taking the drugs if they're taking combination or just one type.